I predict that what they're going to do is try to change the birth dose of hepatitis B vaccine so that kids don't get it when they're born. So if you have a mother who is well connected to care, you know her hepatitis B status, that may not matter very much.
Which is almost every mother. Every mother.
Which is almost all. It's very few mothers are hepatitis B positive. You can find it out, and then you can either vaccinate those women or you can give them therapeutics. 4 million babies get a birth dose of hepatitis B, and some of them die. It is absolutely absurd. By the time somebody's actually sexually active in their teens, that vaccine may well have worn off.
Come see me on tour in Appleton, Wisconsin, Rosemont, Illinois, Chicago, Illinois, Louisville, Fort Wayne, Hermosa Beach, Sacramento, San Francisco, Irvine. Go to jimmydore.com for a link for tickets. I'm here with our special guest from the Children's Health Defense. Mary Holland is with us. And this is the big story. I was excited to talk about this. More than 1,000 HHS staff call on RFK Jr. to resign. Now, we're going to find out that this has been coordinated. And it all started over this woman who, when she got appointed as the CDC head, we were immediately suspicious of her. She comes out of the DARPA. She has very shady past, and she's been... So here it is. New Susan Monterez was fired as CDC director for trying to keep mRNA shots on the recommended childhood vaccine schedule and saying vaccines save lives. She has a long history of connections to Bill Gates and his foundation, such as her time at Stanford for postdoctoral research, where she worked in a department chaired by Mark Davis, who went on to receive $50 million from the from Bill Gates and Gates Foundation, I'm guessing, before the pandemic to create vaccines, and found the university's human system and founded the university's Human Systems Immunology Center. Monterez has also served as the deputy director of ARPA under Biden and oversaw a partnership with biotech firm called Ginkgo Bioworks. This firm was underwritten by Gates' controlled investment firm, Cascade Investment. So that was the big... so he fires her, and then this guy resigns, right? So this guy...
He and 3 others. She wouldn't fire him and 3 others who were really in charge of vaccine policy. And so he fired her, and then the 4 resigned. And then she wouldn't leave, and then Trump fired her, and she's litigating.
So I just want to show you who this guy is. So his name is Dr. Demetre Daskalakis, and he was a top official who abruptly resigned from the CDC. He posted his resignation on Twitter, and it got more than 19 million views, right? And so here's who he really... I just want to show you this. So he is a shill for Big Pharma, no doubt about it. This guy is a liar and a shill, and either that or he's the worst scientist / doctor I've seen in my life, because here he is. You're going to hear him recommend the hepatitis B vaccine for babies. And as we all know, the only reason you need a hepatitis B vaccine is if you're an intravenous drug user or you're having unprotected sex. So at the best, you should probably wait to give that vaccine to someone until they're in their teens. And the mothers, so he gives a bogus reason for this. Let's listen.
I mean, from my vantage point as a doctor who's taken the Hippocratic Oath, I only see harm coming. I may be wrong, but based on what I'm seeing, based on what I've heard with the new members of the Advisory Committee for Immunization Practices, or ACIP, they're really moving in an ideologic direction where they want to see the undoing of vaccination. They do want to see the undoing of mRNA vaccination. They have a very specific target on COVID, but I do fear that they have other things that they are going to be working on. Hepatitis B vaccine is on the agenda for the meeting in September. I predict that what they're going to do is try to change the birth dose of hepatitis B vaccine so that kids don't get it when they're born. So if you have a mother who is well connected to care, you know her hepatitis B status, that may not matter very much.
Which is almost every mother. Every mother.
Which is almost all. It's very few mothers are hepatitis B positive. You can find it out, and then you can either vaccinate those women or you can give them therapeutics. 4 million babies get a birth dose of hepatitis B, and some of them die. It is absolutely absurd. By the time somebody's actually sexually active in their teens, that vaccine may well have worn off. So in the best of circumstances, it's problematic. It used to contain mercury. It doesn't have mercury anymore, but it does have aluminum. It's a very dangerous vaccine that babies don't need. And I think he's absolutely right. The newly constituted advisory committee is going to look at the hepatitis B vaccine at the end of the month as well. They should. It's a crazy federal recommendation that most hospitals comply with around the country.
Now, for the purposes of YouTube rules, I can't go against what the CDC is currently recommending. They currently recommend that a baby gets their first vaccine is the hepatitis B vaccine. So that's, I can't disagree with what the CDC currently says. That's what they currently say. And you know what's funny is when I tell people, so I remember I was at a Christmas party in Hollywood, a lot of Hollywood types there. And there was one gentleman there who was, he was a doctor. And he was retired. He was 73. And he said, we got to talking about the election. And he said, I'm worried that Bobby Kennedy's going to, get rid of the vaccines. And I go, well, do you know that there's 72 shots now on the schedule, child schedule? By the time you're 18, you could say, he goes, what, 72? I go, yes, 72. How many did you get when you were a kid? How many did I get? I think I got 4. I said, now there's 72. He said, oh, I didn't know that. I said, you know what the first vaccine they give to a baby is? He didn't know. I said, it's the hepatitis B. His jaw dropped. He goes, huh? Why would they do that? I go, you tell me. That's why Bobby Kennedy's there. And that's why they're fear-mongering people like you against Bobby Kennedy, because he's on the right side of this. And that's what they're afraid of. And it's going to cut into their vaccine. That guy's mind was blown. He was a doctor and he didn't know any of that stuff. So it is very curious. Lots of people are very skeptical of giving a hepatitis B vaccine to a baby. And just as you pointed out, if the mother has hepatitis, you could test her, she's got it. And then you could give her a therapeutic or give her the vaccine.
Absolutely. Immunoglobulin. But that guy even admitted that of the 4 million shots that are given on the day of birth throughout the country, it's almost entirely unnecessary. We're talking about a few tens of thousands of women maximum who are hepatitis B positive. I mean, it's a moneymaker. It's $1 billion moneymaker, and it's putting children at risk for no reason.
So and he's worried that they're going to stop giving the hepatitis B vaccine to newborn babies. He's worried about that. He wants that to keep going.
So there was a reason why Menares was asked to fire this guy.
So she was asked to fire him, and by Bobby Kennedy, she was asked to fire him. She wouldn't. And so then did Bobby fire him?
So Bobby fired her, and then he and 3 colleagues walked off the job and resigned with a lot of fanfare. And then they got people outside, other employees, to cheer. They clapped them out when they left the offices, and then they've gone on to the news shows and social media to plead their case about how horrible Bobby Kennedy is. I heard really good news today, Jimmy, that the first president of Children's Health Defense, Lynn Redwood, who is a nurse practitioner and who's studied vaccines for over 20 years, she is now going to be at the Centers for Disease Control advising as a special employee, advising on vaccine policy. So there's change coming. The acting director at the CDC now is Jim O'Neill, somebody who'd been at HHS with Bobby Kennedy. He's clearly aligned in carrying out this Make America Healthy Again agenda that does include a full-scale review of the vaccine schedule. Over 50% of American kids have some kind of chronic health condition. You cannot exclude the possibility that the vaccines are playing a role in that. You absolutely cannot exclude that possibility. The rise in chronic health conditions, it parallels the rise in vaccination.
So there was something like 11% of children had chronic health conditions, and then when they got immunity from prosecution over vaccines, they exploded the child vaccine schedule. Now from I think it was 4 or 6 shots now to 72, and chronic illness is correlated with that. Now it's up to 50% of kids have chronic illness. So we don't have the science on whether that's directly connected to vaccines, but a lot of people are suspicious that it is directly connected to it. It certainly is a correlation.
Very strong correlation. And a lot of what people have trouble with are autoimmune conditions. And we know that hyperstimulation of the immune system can result in autoimmunity. So there's a lot of reasons to imagine that there are serious problems in the way that we're vaccinating children. It doesn't mean that all vaccines are bad. It doesn't mean that there couldn't be better vaccines. It doesn't mean that you couldn't potentially rearrange the schedule. But our position at Children's Health Defense is that there should be no medical mandates that everybody has to comply with. Everybody's different, and people need different medical interventions. You can't have a one-size-fits-all system without harming some people. And the law actually even acknowledges that. That's why they gave the liability protection to the doctors and to the pharmaceutical industry, because they knew that these products were going to kill and injure some people.
And, you know, they say, you know, I've heard the head of Pfizer, Boyle, say that the reason they need the shield from civil suits over vaccines is because people will just make up, well, I got in a car accident and I'm going to blame the vaccine. Well, they could do that with any drug, and they don't have that protection for any other drug that they sell.
No other. Absolutely right. You know, drugs are not protected, and drugs are litigated all the time, and they're often pulled off the market, and there are billion-dollar settlements. Do you really think that where there's no good oversight or litigation potential, that these companies are a lot more honest? It's not really logical.
Well, here's what Rand Paul said. Rand Paul said, no medical reason to give newborns hepatitis B vaccine if mother is not infected. All mothers who deliver in a hospital are tested. The scientists' fetish for vaccines not supported by the data. That's what that is. That is a fetish for vaccines at the best. That's at best.
At best.
At worst, he's being paid to lie and give bad medical advice to people. And I lean towards the latter. I think that he knows his career and where the money is, and he doesn't have any integrity as a doctor, as far as I'm concerned, because well, here's what I like what Kelly Means tweeted out. He said, the leader of the CDC, who is being held up as the face of science, covered up and falsified data on myocarditis risk, encourages to this day COVID shots for every 6-month-old, encouraged orgies as normal Friday night activity. That was during monkeypox. He's talking about this guy. He was saying, you know, orgies are okay. That we should support their joy. That's what he said. Openly encourages bondage and devil worship. Well, that's none of my business. And implied it's bigoted to use the word mother instead of birthing person. This man is the leader of the experts we are told to trust. Americans have a very clear choice: more of the status quo or reform. So that's that guy. So that's that same guy. And what here's what Marianne Demasi, she so this guy here, Retsev Levi, is that how you say his name? Levi?
Levy, I think.
Levy, okay. So several top CDC officials quit in protest, announcing Restev's leadership of the COVID vaccine work group. Now it's an exclusive interview. He reveals what really happened behind closed doors. So what most people don't know is that in the weeks leading up to his resignation, Dr. Demetre, this big liar guy who made all the news, had been working with Levy and other members of the ACIP, locked in a tense tug-of-war over how broad the work group's remit should be. As chair, Restev pushed for a wide lens that would follow the evidence wherever it led. That guy, Dr. Demetre, on the other hand, pressed to narrow the scope of the review and sought to populate the group with CDC loyalists intent on preserving the status quo. So senior CDC officials opposed to Levi's broader approach were reluctant to sign off on the terms of reference. So here is what she's talking about. What really happened? What went on behind closed doors between ACIP and the CDC officials who resigned? Well, here, I'll just read it to you really quick. Okay, so what exactly happened behind closed doors? So Levi says, so let's go back a bit. Once I was tasked with the role of being the chair of the COVID immunization work group, it was my job in consultation with my colleagues on ACIP and more broadly, as well as with experts from the FDA and the CDC, to formulate an agenda for what the work group should be doing in the coming years. And in doing so, I think we mapped a range of issues, which we spoke about in our last discussion and have been listed in the terms of reference that's on the CDC website. I personally think that the agenda we formulated reflects the intentions to have a science-driven, evidence-based, comprehensive discussion of the risks and benefits of the vaccine products by leveraging and bringing to bear all the available information and knowledge. Previous ACIP discussions on the topic were narrowly focused on very specific questions and on very specific data sources that more often than not provided a very partial analysis and superficial answers, or no answers to critically important questions. They did not analyze a large body of scientific literature published in some of the top academic journals that have direct implications for the risks and benefits of these products and related policy recommendations. And I think that the idea behind the new terms of reference was to change that. We will not exclude any question that is relevant, nor will we exclude any data source or knowledge source that is available. There's one more. So what did the CDC officials who resigned want to exclude from the COVID workgroup's term of reference? Well, the third example was the most shocking to me, emotionally shocking. The first two examples were intellectually shocking, but this one was different. It was their unwillingness to examine the issue of vaccine injuries. To me, recognizing vaccine injuries and vaccine-injured people is a foundational component of any successful vaccine program. You need to care for the people that trusted your system and were unfortunately injured as a result. We have seen a lot of gaslighting and leaving the vaccines injured out to dry. I want that to change with the COVID immunization work group and more generally as a part of the ACIP work. We have recruited to the work group several highly qualified physicians with great experience who have taken care of thousands of vaccine-injured people and long COVID patients, and we're going to use their expertise, use their experience. We'll ask them to help us formulate recommendations about how to improve diagnosis, provide recognition for these patients, and support more research into potential treatments. To me, it's a moral obligation, and the fact that these leaders argued about that was emotionally shocking, if I'm being honest. So this guy did not want to look into the issue of vaccine injured. He didn't want to talk about vaccine injuries, and the head of ACIP right now said that was emotionally distressing to him. The CDC deployed its legal team in an attempt to intimidate ACIP into excluding vital topics from the COVID workgroup's terms of reference, issues that urgently needed examination. So he was asked, can I ask you how they did it? How did they go about asking to remove these topics from the terms of reference? And Levy says, they tried to use the lawyers. They used strange legal arguments to say that it was not in the scope of ACIP to examine these issues. I could not accept that. As it turns out, they were wrong because it is in our scope, and now we intend to examine these issues. This sounds intense. It was not pleasant, he says. So
bravo, Retsev Levy. Bravo. I mean, I'm so glad that he stood his ground. And that working group, Jimmy, is also a sign that this administration is serious at looking back at what happened during COVID, particularly with the COVID shots.
And so, again, a lot of people, I've been on the side of RFK on this, and I'm just like, yeah, he's not doing everything at the speed that we'd like, but it's going in the right direction. And now you see the knives are out for RFK because he's actually going to use science, and he wants to have actual testing for vaccines, meaning placebo tests, which they have never done. Never. They've never done those. People don't know that. People don't know that vaccines have not been tested against a placebo. They've been tested against other vaccines.
Right. And what they did, they actually did use placebos for the COVID shots, Jimmy, but then they vaccinated the placebo group. So you can't have any long-term studies. I mean, they just at every turn, it's not really science.
So let me just finish with this. For his part, Restev, how do you say his name? Levi?
I think it's Levy, but it could be Levy. I don't know.
For his part, is not interested in taking pot shots or fueling a social media brawl, but he is prepared to set the record straight. Levi was or Levy or Levy, I don't calm and deliberate, weighing his words carefully, but there was steel behind them. The attack, he told me, didn't faze him. I'm as focused on the data now. I'm not going to engage in personal attacks. So good for him. So, and just to let you know, the knives are out. They're all coming for him. Bernie Sanders has called for RFK to resign. Patty Murray from Washington. John Ossoff, Democrat from Georgia. What a garbage person. Chuck Schumer. Here's Chuck Schumer. Fire RFK Jr. now. So they're panicked, which means to me that RFK is over the target.
Over the target. That's exactly what it means, Jimmy. And
so now you know what really happened with this faker. I just really wanted to. So this guy, as far as I'm concerned, is a corrupt, criminal, maniac, anti-science liar, and of course, all the shit libs, as I call them, who don't know, who get their medical advice from people who are funded by Big Pharma. They turn on MSNBC, they turn on CNN, they go to Fox, they go to Wall Street, the Journal, they go to New York Times, Washington, all these places that are funded by Big Pharma to lie to you, like Rolling Stone magazine when they said that you couldn't see an emergency doctor because there were so many ivermectin patients clogging up the emergencies, and that was all a lie. They just made that up. Nobody has to pay a price for that, just like his lies. Nobody has to pay a price for that. And so I want to show you just one more thing. So now that they're coming for Bobby Kennedy, and I want to show you just one more thing. So they also fired this guy, Paul Offit. Now, I've known Paul Offit was a charlatan, liar, corrupt piece of it for a long time. And so I couldn't believe he was still working there. But I just want
he's on an advisory committee at the FDA, and he was taken off the advisory committee. He was not renewed, which is great news. He is very biased. He's another pharma tool, essentially.
And here's Callie Means. He's going to give him a dressing down about Paul Offit's lies and conflict of interests.
What's causing distrust in public health authorities is conflict of interest, like Dr. Offit taking millions of dollars from pharmaceutical makers like Merck while approving and recommending pharmaceuticals on ACIP committees. It's the fact that Dr. Offit saying that science is always settled when he himself has approved vaccines that have been recalled for causing organ failure for kids. And it's the fact that Dr. Offit is talking about measles, which is important. And I want to be clear, Hamel, I don't want to get this out. It's important. But there were 300 deaths from measles a year before the invention of the vaccine. We have 38% of children right now having prediabetes. Bobby is focused on that. He's focused on reorganizing the department. And that's what we should be talked about, not this distraction.
So I want to show you one more clip of Dr. Paul Offit, who recently got let go by RFK at the FDA in his advisory role. Here he is. He's going to admit to you that he knew that you should not recommend the COVID vaccine for healthy people, especially children. He knew this. He told Dr. Fauci this. Dr. Fauci said, yeah, I know that too, but we're going to lie anyway. You think I'm kidding? Let's watch this.
Meeting maybe a year ago or so, because I was already getting out there saying, I think we should target high-risk groups.
So he was saying we should just use the vaccine, which is very much like what was the declaration called? Anyway,
the Great Barrington Declaration.
The Great Barrington Declaration said that you should target vulnerable populations, elderly people with
protect the elderly and let everybody else go about their lives.
And so he's
never lockdown.
So he's claiming that he was saying that also, but he wasn't saying it publicly. And so here, watch this.
Getting a lot of pushback from public health people who felt that I had gotten off the bus, because see, that was the whole feeling in this. You know, you're either on the bus or off the bus, and there was no in between. So I'd gotten I said, Tony, am I wrong? Am I wrong in making it? He said, no, you're right.
So he said to Anthony Fauci, am I wrong by saying we should only recommend the COVID vaccine for vulnerable people, the elderly and people with comorbidities? Am I wrong? He asked Dr. Fauci, am I wrong? And Dr. Fauci says, no, you're not wrong. But listen to the next part.
We should target high-risk groups. He said, the problem is, the minute you say that, it becomes a nuanced message. And a nuanced message is a garbled message. If you really want to make sure those groups get vaccinated, then you recommend it for everybody. And okay, so if we think that, we should say it. Because my personal thinking on this is, then if that's the reason we're vaccinating healthy 16-year-old boys, that's not a good reason. And just have it open. Say it openly. You know what I'm saying? Because I think people are smart enough to hear it.
So he's admitting there that what Dr. Fauci, the CDC, the FDA, they were all lying to people by saying that they should get the COVID vaccine when they knew they didn't need it. And he's admitting that they all lied, and he's admitting he went along with it. He went along with it because you have to either be on the bus or off the bus.
Or off the bus. And he always wants to be on the bus.
And so he wanted to be in the inner circle. He didn't want to be shut out because and so what would get him shut out? If he stood up loudly and told the truth about what he just said there. So if he was saying that in 2021, he would have got kicked out, and they would have called him fringe.
Anti-vaxxer. And he would have been an anti-vaxxer.
They would have called him an anti-vaxxer. So those are the kind of people they're firing over at the CDC. And I say bravo to President Trump and bravo to RFK Jr. for getting rid of these people who I would call pukes. I would call these people corrupt. I would call these garbage people. And there's no bigger garbage person than Paul Offit and Dr. Demetre, who's still recommending a hepatitis B vaccine for babies, for newborn babies, when we already know if the mother has hepatitis or not. You test the mother, and then you'll know. And then you don't have to give that vaccine to that baby. But he's all for it because he's corrupt. Hey, you know what's broken? Our so-called healthcare system. You get sick, you jump through hoops, beg your doctor for something that's been around for decades, and they still tell you no. And insurance, forget it. They never cover what actually works. That's why I use All Family Pharmacy, a patient-first independent pharmacy that says yes when others make you wait. They connect you with licensed U.S. doctors who review your requests online quickly, legally, and without all the red tape. They've just lowered prices on most ivermectin and mebendazole up to 25%. Ivermectin starts at just $2 a capsule. And now they've got NAD+, the anti-aging injectable everybody's talking about. Here's how it works. Order online in minutes. A licensed doctor reviews your order to make sure it's right for you, and your medication ships straight to your door. No waiting rooms, no gatekeepers, no insurance middlemen telling you what you can and can't have. Take control of your health. Use the code DORE10 and go to allfamilypharmacy.com/door right now. Your health, your choice. Come see me on tour in Appleton, Wisconsin, Rosemont, Illinois, Chicago, Illinois, Louisville, Fort Wayne, Hermosa Beach, Sacramento, San Francisco, Irvine. Go to jimmydore.com for a link for tickets.